Welcome back, everyone, to the 21st Century Man podcast. You know, we are all about diving deep into each chapter of this awesome book, and today we're tackling a topic that's, well, always at hand, so to speak. Chapter 28, Hand Health.
Hand health. Yeah, it's one of those things you don't really think about until you have a problem, right?
Exactly. Like, how many times a day do you use your hands? It's got to be in the thousands, right?
Oh, yeah, for everything from texting to driving to, well, just about every task imaginable.
And the thing is, as men, we often put our hands through a lot. I mean, we're out there building things, fixing things, playing sport.
Absolutely. And we often don't pay much attention to those aches, pains, or tingles until they become a real problem.
And that's where this chapter and this deep dive really shines.
Mhm.
We're going to be drawing insights from an orthopedic surgeon, a specialist in hand surgery, no less, to give us the knowledge we need to keep our hands healthy and hopefully avoid any serious issues.
This chapter really emphasizes that how men think about their hands is often different from, say, a woman's perspective.
Right. It's all about getting to the heart of the concerns that men have.
Right. So let's jump in.
Okay. So the first thing that struck me in this chapter was how it goes beyond the obvious cuts and scrapes. What's this peripheral nerve compression all about?
It's a big one. Basically, it's what happens when a nerve gets pinched or compressed, and it can lead to some pretty serious issues down the line.
Like what kind of issues are we talking about here?
Well, think about things like carpal tunnel syndrome, which, by the way, affects over 10% of adults in America. That's huge.
Yeah, I've definitely heard of that. But what actually happens when a nerve gets compressed? Is it just pain?
It can be pain, but it can also be way more than that. You might experience numbness, tingling, even weakness in your hands and fingers.
Oh, so like when your arm falls asleep. Is that kind of similar?
Yeah, sort of. That's a temporary compression, but imagine it lasting for weeks, months, or even years.
And the book mentions that if this nerve entrapment, as it calls it, is left untreated, you could actually lose muscle function permanently.
Right. You can also lose sensation and even develop arthritis in your hand joints.
That's pretty scary stuff.
Yeah.
So where could these nerves get pinched?
Well, several places, actually. The carpal tunnel in the wrist is probably the most well-known.
Okay, great.
But then you've also got the cubital tunnel at the elbow, which is where that funny bone nerve runs.
Oh yeah, I hate hitting that thing.
And then there's Guyon's canal, also in the wrist, the thoracic outlet, which is up between your collarbone and first rib, and even neural foraminal stenosis, which happens in the neck. So it's not just about the hand itself.
Wow, so it's all connected.
Exactly.
Okay, so let's focus on that carpal tunnel for a second.
Right.
What exactly is going on in there that can cause these problems?
So the carpal tunnel is basically a narrow passageway in your wrist. You've got bones on three sides and then a ligament stretching across the top, forming like a roof.
Okay.
And through this tunnel run the tendons that control your fingers, as well as blood vessels, and importantly, the median nerve.
The median nerve.
Now, when anything in that tunnel starts to swell or take up more space, it can put pressure on that median nerve. And that's when the trouble starts.
So what are some of the early warning signs that you might be having a problem with that median nerve? What should people be looking out for?
Well, one of the first things you'll likely notice is tingling, or that pins and needles sensation in your fingers, especially at night.
Oh, okay.
Now, if that pressure continues and it's not addressed, the muscles in your hand can actually start to weaken and shrink, which is called atrophy.
And this is a sign that things are getting pretty serious,
Yeah.
right?
This chapter really stresses that once that muscle atrophy starts to happen, it can be a sign that the nerve damage is becoming irreversible.
So you don't want to wait until it gets to that point.
Yeah.
If you're having persistent tingling, you should definitely get it checked out.
Absolutely. And it's not just about the tingling and the muscle weakness either. This imbalance in muscle strength can also lead to problems with the joints themselves.
Like arthritis.
Exactly. And again, that can be irreversible. So it's a whole cascade of issues that can stem from this seemingly simple problem of a pinched nerve.
Okay, so, this is pretty heavy stuff. But the good news is that this chapter also provides some really practical advice on how to prevent these nerve compression problems in the first place. And it really emphasizes the importance of body mechanics, how we use our bodies.
Yeah, and it all starts with posture, which, let's face it, is something many of us struggle with, especially in today's digital world.
Absolutely. I mean, think about how much time we spend hunched over our phones or laptops. This chapter mentions that the average American spends over 4 hours a day on these devices.
4 hours a day. And all that time looking down at our screens puts a tremendous amount of stress on our necks, our cervical spine.
Right, you're constantly bending your head forward, which the book calls neck flexion.
Exactly. And that puts a ton of extra pressure on the bones and discs in your neck.
And not just the bones, right? It's also all the muscles in the back of your neck that have to work overtime to hold your head up in that position.
Right. And over time, all that strain can lead to muscle fatigue, pain, and even degeneration of the cervical spine itself.
And the worst part is, this bad posture doesn't just affect your neck, it can also impact your arms and hands.
Yeah. When you slouch or hunch over, it actually reduces the space in the thoracic outlet.
Thoracic outlet, remind me, what's that again?
Right. It's that area between your collarbone and your first rib where the nerves and blood vessels that supply your arm pass through.
Okay, so it's kind of like a bottleneck for those nerves.
Exactly. And if those nerves get compressed there, it can lead to problems all the way down to your hand. And the chapter points out this interesting phenomenon called the double crush phenomenon.
Double crush phenomenon.
Yeah. It's basically the idea that nerve compression in one area, like your neck or thoracic outlet, can actually worsen nerve compression in another area, like your wrist or elbow.
So it's like if the nerve is already a bit irritated in one spot, it's more vulnerable to problems in another spot.
Right. It's like a chain reaction.
Okay, makes sense. So we've talked about neck posture, thoracic outlet, but what about the position of your arm and wrist when you're using them? Does that matter too?
Absolutely. And this chapter highlights a couple of key angles that you should be mindful of. First, when you bend your elbow beyond 90 degrees, like really sharply bending your arm, it increases the pressure on the ulnar nerve.
Which is?
That's your funny bone nerve. You know the one.
Oh yeah, definitely know that one.
And that nerve is super important for the function of those small muscles in your hand, and it also controls sensation in your ring and little fingers.
Okay, so avoid sharp elbow bends. Got it. What else?
The other thing to watch out for is bending your wrist too far up or down.
Like when you're typing or using a mouse.
Exactly. So
Okay.
bending your wrist up is called extension. Bending it down is flexion. And going beyond about 8 degrees in either direction can put extra pressure on that median nerve in the carpal tunnel.
And again, that median nerve is what we want to protect. Okay, so a lot to think about here. But the good news is that this chapter gives us some really specific and actionable advice on how to avoid these postural pitfalls.
Yeah, and they're not complicated either.
Let's hear them.
All right, rule number 1 is all about posture when using computers and other digital devices. The key is to sit up straight with your head upright and looking straight ahead.
Easier said than done, right?
It can be, but you might need to actually raise your laptop or your phone up to eye level. Use a stand or a stack of books, whatever it takes.
The author even mentions that he uses a soft neck brace when he's traveling to keep his head in a neutral position. I thought that was pretty hardcore.
It shows you how seriously he takes this stuff.
Yeah.
Rule number 2 focuses on how you position your arms and wrists when typing. Ideally, you want your elbows bent at about a 90-degree angle, kind of like an L shape.
Okay.
And your wrists and forearms should be relatively flat on the desk or slightly extended. Adjusting your chair height can really help with that. And one little tip, make sure those little legs on the back of your keyboard are folded down flat.
Why is that?
Because it keeps the keyboard from tilting up, which can force your wrists into a bad position.
Oh, that's a good point. I hadn't thought of that.
And finally, be extra mindful of your posture when you're using laptops and tablets because their design often encourages slouching.
Makes sense. So if someone's been experiencing some of these hand or wrist issues we've been talking about, numbness, tingling, or weakness, at what point should they actually go see a doctor?
This chapter recommends that if the symptoms are severe or if they've been going on for more than about 4 weeks, it's definitely time to consult a doctor.
Okay, 4 weeks.
And they even mention that a quick telemedicine consultation might be a good first step to get some initial guidance.
Okay, great. So let's move on to the next section of the chapter, which dives into the joints of the hand. And it starts with a really clear explanation of what a joint actually is, which I thought was helpful. Can you break that down for our listeners?
Sure. So imagine the end of a bone. There's a smooth cap on it, right? That's cartilage.
Okay, cartilage.
And in a joint, you have 2 of these cartilage-covered bones coming together.
Okay.
Typically, one side's curved inwards, the other's curved outwards, and that allows them to move smoothly against each other.
So it's like a ball and socket.
Kind of, yeah.
Yeah.
And the whole thing is enclosed in a capsule that's filled with this lubricating fluid. It's a mixture of glucose and protein, and it makes those cartilage surfaces super slippery.
Super slippery. How slippery are we talking here?
The chapter actually says it's about 100 times more slippery than ice on ice.
Wow, okay. So there's so little friction How does cartilage wear out? I mean, how do you get arthritis?
That's a good question, and this chapter makes it clear that it's not actually friction that's the main culprit, it's compression.
Compression.
Yeah, too much pressure on those cartilage cells. And while a sudden injury, like a fall, can overload the joint, it's actually more common for cartilage damage to happen gradually over time from chronic misuse of the hand.
So like repetitive motions.
Exactly. And it's important to remember that the health of your joints is really tied to how well your nerves and muscles are functioning. It's all connected.
Right, it all comes back to that.
Mm-hmm.
Okay, so now let's talk about that incredible tool we have, the opposable thumb. What makes it so special, and what are some potential pitfalls we should be aware of?
Right, so the thumb is opposable, which means it can rotate and face the other fingers. That's what allows us to grasp and manipulate objects with such precision.
Right.
But because of this unique movement, when you pinch something between your thumb and fingers, it actually puts stress on those finger joints in a way they weren't really designed for.
So it's like using the wrong tool for the job?
Sort of, yeah. It creates what's called an eccentric force, a high compression force on one side of the joint.
And that can lead to problems.
It can, and this is actually one of the main reasons why arthritis often develops on that far side of the finger joint, the side towards the pinky finger.
Okay, so pinching is a no-no.
Well, not exactly. You can't avoid pinching altogether, but you can be mindful of how you do it.
So what are some tips for protecting those finger joints?
The chapter gives some good ones. First, when you're lifting objects, try to position your fingers so they're pointing upwards rather than relying mainly on your thumb for grip. That helps distribute the force more evenly.
Okay.
And when you're handling small objects, try to use a lighter grip or even find a way to make the object bigger so you're not putting so much pressure on just one or two joints. For example, if you're writing, use a pen with a wider grip.
That makes sense. So spread the load, basically.
Exactly. And finally, if you do have to use a strong pinch grip, try to pinch towards the side of your finger rather than just using the tips of your thumb and index finger. Again, it's all about distributing that force.
Okay, great advice.
Mm.
Now let's move on to something else that we often take for granted, the skin on our hands. This chapter makes the point that our hands often reveal our age.
They do, don't they? And it's because our hands are exposed to so much. Sun, wind, chemicals, you name it.
Right, and all that exposure takes its toll over time.
Yeah.
What are some of the changes that happen to the skin on our hands as we age?
Well, sun damage is a big one. It can thin the dermis, which is that deeper layer of skin, and it can also lead to wrinkles, laxity, and that rough texture we often associate with older hands.
And it's not just about cosmetics either, is it?
Nope. Skin cancer is a real risk, especially on the hands. We're talking about squamous cell carcinoma, basal cell carcinoma, and even melanoma, which can be deadly.
And the chapter also mentions that our nails are vulnerable too.
Right, especially to those squamous cell carcinomas. And the nail fold, the skin around the nail, can be particularly susceptible if it's constantly exposed to moisture or minor trauma.
What about infections? This chapter talks about nail bed infections, both the acute kind and the chronic kind.
Yeah, acute nail bed infections are pretty common, and they usually happen after some kind of minor injury, like a cut or a hangnail. Chronic nail bed infections, on the other hand, are more often fungal in nature, and they tend to be a problem for people whose hands are frequently wet or exposed to moisture.
So like dishwashers or construction workers.
Exactly. And speaking of nails, this chapter has a really important message about cuticles.
Cuticles.
Yeah, that little strip of skin at the base of your nail. It's actually really important for preventing bacteria and fungi from getting in and causing infection.
Okay.
So you should never cut your cuticles or push them back too aggressively.
So no more cuticle trimming at my next manicure. Noted. What are some other tips for protecting the skin on our hands and keeping those nails healthy?
Well, sunscreen is a must, even in the winter. Find a broad spectrum SPF lotion that also has a moisturizer in it and use it daily.
Okay.
And wearing gloves is also super important, especially when you're doing anything that exposes your hands to the elements, chemicals, or potential trauma.
So gardening, washing dishes, working on the car, you name it.
Exactly. Gloves are your friends.
Got it. Now let's talk about wrists. And this chapter starts off with a warning about a common saying that can actually be quite dangerous.
Yeah, that whole if you can move it, it's not broken thing.
Right, which is totally not true.
Definitely not true. And it can lead to people delaying treatment for serious wrist injuries, which can result in permanent damage.
And the chapter goes on to describe 3 specific types of wrist injuries that can be quite subtle, but have some pretty major consequences if they're not treated properly.
Yeah. And those are SNAC wrist, SLAC wrist, and articular fractures.
Okay, let's break those down one by one. What is SNAC, wrist, and what should people know about it?
SNAC stands for scaphoid non-union advanced collapse.
Okay.
And the scaphoid is a small bone on the thumb side of your wrist. It's often fractured and falls. And the problem is that if the fracture isn't treated properly, the bone might not heal. And that can lead to this really debilitating form of arthritis called SNA3 wrist.
So what are the symptoms of a scaphoid fracture? What should people be looking out for?
Well, it can be tricky because the symptoms can be pretty mild. You might just have some tenderness on the thumb side of your wrist. But if you've had a fall or an injury and you're having any kind of persistent pain or discomfort, it's really important to get it checked out.
And is an X-ray enough to diagnose it, or do you need something more specialized?
Sometimes an X-ray is enough, but often you need an MRI to really see the fracture clearly.
Okay, good to know. So that's SNAC wrist. What about SLAC wrist?
SLAC stands for scapholunate advanced collapse, and it involves a tear in a ligament in the wrist called the scapholunate ligament.
A ligament, not a bone.
Right. And this ligament is important for stabilizing the wrist joint. If it tears, it can disrupt the normal mechanics of the wrist, and that can lead to, you guessed it, arthritis. SLAC wrist.
Okay, so what are the signs of a scapholunate ligament tear?
Again, it can be subtle. You might have some pain or tenderness in the wrist, maybe some clicking or popping, but it's often mistaken for a sprain, which can be a problem because a sprain will heal on its own, but a torn ligament often needs surgery to repair it.
Okay, so another one to watch out for. And then the last one you mentioned was articular fractures. What are those?
Articular fractures are fractures that involve the joint surface.
Any joint in the hand.
Yeah, it can be any joint in the hand or wrist,
Okay.
and they can happen from even seemingly minor injuries. The problem is that if an articular fracture isn't treated properly, it can disrupt the smooth movement of the joint, and that can lead to post-traumatic arthritis.
So with all these wrist injuries, early diagnosis and treatment are key.
Absolutely.
And you might even need to see a specialist, right?
Yeah. The chapter really emphasizes the importance of seeing a hand specialist, especially for these more subtle injuries that might be missed by a general doctor or even a general orthopedic surgeon.
Okay, so don't mess around with wrist pain. Get it checked out by a specialist.
Exactly.
All right, so this next section in the chapter is titled Your Brain. And it's not what you'd expect in a chapter about hand health.
Yeah, this is where the chapter gets real.
It talks about how even the smartest, most capable people can make incredibly bad decisions when it comes to their hands.
And it shares some pretty horrifying examples.
It's like the running lawnmower scenario. I can't believe people actually do that.
I know, right? Trying to clear grass or debris from under a running lawnmower with their bare hands.
It's insane. And the chapter also mentions Thanksgiving finger, which I'm not even going to describe, but let's just say it involves a turkey and a knife.
Not a good combination.
Not at all. So what's the takeaway here? What are some common sense tips for protecting our hands from these kinds of preventable injuries?
Well, rule number 1, always cut away from your hand.
Seems obvious, but apparently it's not.
The chapter actually shares this story about a concert pianist who cut herself while making sushi.
Oh, no.
Yeah, she was using one of those super sharp sushi knives, and she cut towards her hand, severing a nerve and a couple of tendons.
Ouch. Was she able to play again?
Thankfully, yes, after surgery and months of rehab, but the author emphasizes that not everyone is so lucky.
Yeah. Okay, so cut away from the hand. What else?
Rule number 2, use the right tool for the job. Your hand is not a hammer, it's not a wrench, and it's definitely not a lawnmower blade guard.
Right.
There's a condition called hypothenar hammer syndrome that can develop from repeatedly using the heel of your hand as a hammer, and it can actually damage an artery in the palm, which can be really serious.
Wow. So tools, not hands.
Exactly. And the final tip is just to use common sense. Think before you act, and don't put your hands in harm's way unnecessarily.
Good advice. So when should someone actually go see a doctor for a hand problem?
Well, the chapter lists a few key signs that you should seek medical attention. Joint pain or swelling that doesn't go away after a few days, any signs of infection like redness, warmth, swelling, or drainage, any weakness in your hand or fingers, numbness or tingling that lasts for more than a few days, any visible deformity or any unusual skin lesions. These are all red flags that you should get checked out.
And when you do go see a doctor, is it better to see a specialist or is your regular doctor okay?
Well, for most hand and wrist problems, it's best to see a hand specialist.
A hand specialist.
Yeah, they have the most training and experience in treating these types of issues.
Okay, good to know. So this chapter really covers it all. It's like a comprehensive guide to hand health for men.
It is. It's packed with valuable information, and I highly recommend that everyone read it.
Me too. And it ends with a key takeaways section that answers some common questions about hand health. Let's go through a couple of those quickly.
Sure.
First up, knuckle cracking. Is it bad for you?
Well, the chapter explains that the cracking sound is most likely caused by gas bubbles forming in the joint fluid. It's called cavitation.
Cavitation.
And while there's no strong evidence that it causes arthritis, it's probably not the best thing for your joints in the long run.
Okay, so maybe cut back on the cracking.
Yeah.
What about hand exercises? Are those little grip strengthener gadgets any good?
The chapter points out that overall health and fitness are more important for grip strength than specific hand exercises. Things like childhood physical activity and testosterone levels actually play a bigger role, and getting enough sleep is also super important. So generally, they don't recommend those hand strengthening exercises unless you're recovering from an injury or something like that.
Okay, so put down the grip strengthener and hit the gym instead.
Exactly.
All right, last question. This one's for all the tough guys out there. How do you throw a punch without injuring your hand?
The best advice is don't punch anything or anyone at all. But if you absolutely have to throw a punch, the chapter gives a few tips. Keep your wrist straight, aim for the end of your reach, and lead with the knuckles of your middle and index fingers.
Why those knuckles?
Because the knuckles of your ring and little fingers are weaker and more prone to fracture.
Oh, that makes sense.
And if you're really serious about punching, like boxing or martial arts, it's best to learn proper technique from a qualified professional.
Absolutely. Well, that wraps up our deep dive into Chapter 28. It has been incredibly informative, and I know I've learned a lot.
Me too. And it's a great reminder that we need to take care of our hands. They're amazing tools, but they're also vulnerable to injury and disease.
And this chapter gives us all the knowledge we need to keep them healthy for years to come. So thanks again for joining us.
You got it.
And be sure to join us next time as we explore another crucial topic for the 21st century man, Chapter 29, Optimizing Sleep.